Just a reminder, we are here at the MLK Heritage Health Center on King Drive, and this is where the 7th annual Thanksgiving dinner giveaway is taking place, and we've got a lot of elected officials here, and here's a newly elected official who's been on our issues many times, just elected to the 16th Assembly District, State Representative Kaylan Haywood II. How are you?
I'm doing excellent. How are you?
It's always good to see you, and you don't get sworn in until January, but you've been making your rounds and being in all the places where you can kind of talk to people, get a feel for what it is that's on their hearts and minds when it comes to legislation. And this health center is in your district. So let's talk about the disparities in healthcare and your thoughts on that.
I represent a very, very, very diverse district. I think it's one of the most diverse in the state when it comes to assembly districts. I have downtown with development, investments, and some of the wealthiest people in the city. I also represent 53206, which is nationally known for incarcerating young black males like myself. Where they have issues when it comes to getting employment, keeping quality housing, crime levels, like those are issues that they face every day. But I have other side, like, so it's like two polar opposites.
Yeah.
One's on the south end, one's on the north end, so it's kind of unique. But when you go to those people who are faced with more challenges, healthcare is an issue. Too often people wait until it's too late to go get services from health providers. So by that time, it's too late now, nothing can be done. We have to make sure that, which is why today is so important. We have to make sure that people are going to get those proactive instead of reactive treatments and services and checkups so they can figure out, are they healthy, are they staying healthy? If they're not, let's take some preventative measures. So that's why it's so important. When I got here today, I usually don't like parking far. It's not my thing. I had to park 2 blocks away, but I was able to now engage this long line of people outside and talk to my constituents. And it made me feel good that they were not only here to get a Thanksgiving dinner, they were also here for health screenings because it was just that much important to them.
Yeah.
So I'm excited. This happens every year. Thank you to you for being a part of it. This is great for the district. I definitely do. So healthcare is a top priority. Economic development on both ends. We have to make sure that we're plugging in downtown with the other parts of the city and other parts of my district to make sure that the jobs are getting connected to those other that neighborhood, the money, the housing. I want to balance out the district.
Yeah.
I want to make the entire district prosper. So economic development, education is very crucial. I had North Division in my district, right in the heart of my district. And people have been talking about it for the last year about the current status of it when it comes to reaching certain standards and benchmarks on what we should do with North Division, but that's a key component of the community.
Yeah.
It's a stakeholder.
Yeah.
So we gotta find ways to make sure we're getting people properly educated, get them employed, and that's how we break the cycle of poverty. When we break that cycle of poverty, you can now talk about everything else, everything else. So that's the key, breaking the cycle of poverty.
I think that you hit on some key points, and like I said, you've been on the show many times, and we did do a follow-up after you were elected to office, and so many people, including myself, because we've watched you, kind of take the reins in the world of politics as a young man, and you're still really young, 19 years old, and that makes you like the youngest African American to be elected to the state legislature, right?
Yeah, youngest African American ever elected to the state legislature in Wisconsin, and possibly the nation. We're still looking into it, but definitely Wisconsin.
That's amazing. And so I think what's most important when we look at your age, which I know, a lot of times it's been looked at like, don't you think you're too young for this? But I think you've proven everyone wrong, and it's
a different conversation now.
It's a different conversation now. So I think that what I would be interested in knowing is, how do you take the mindsets of the individuals who are along your age group and probably along the millennial age group and take their thoughts and their concerns to Madison, because there is this, divide or gap between the age of the people who are in office already and then someone like yourself who's bringing a whole different viewpoint.
I think we saw a record-breaking turnout for the general and also the primary.
Yeah.
Young people came out and voted. I like to think part of the reason why I won is because young people came out and got engaged. So they gave me the job. they gave me responsibility of representing them. So I have to make sure I stay true to my roots, whether that's young people, my elders. We got to find ways to make sure that everyone's being heard. I went to my first day in the Capitol was last week. Everyone was interested in hearing what I had to say, how I was going to say it, what I was going to say. So just staying true to people that I represent. All my constituents, all about 60,000 of them, make sure that their voices are heard. And I stand my ground. That's what it comes down to. The people that voted me in, that's where my loyalty lies. The district, the state of Wisconsin, and like that's what we have to stay true to.
Yeah, and one last thing as we wrap up. So, what are your thoughts about being sworn in to this office? Because you've done the footwork, you've done all the work, you've gotten elected. What is it going to mean for you to be sworn in and to take on this title?
It's absolutely insane to me. It's crazy. I remember the day I decided I was going to run. I remember pacing back and forth in the office like, are you going to do it? If you say yes, there's no going back. Like, your entire life is going to change. But to this day, I'm very proud I did say yes. It wasn't the easiest thing to do to say yes, because I realized the opportunity I was getting, but also the responsibility that came with it. But I'm stoked, I'm excited. I feel like it's gonna open the door for many people to come in after me, and that's what's most important.
Yeah.
I want the community to feel engaged, like they're a part of this. I didn't win, we won.
All right.
And that's what's key.
All right. Well, you know that we've got a stage here for you anytime when you've got key things that you want to talk about or things that you're doing that you want the community to know about. Always an open door for you.
There we go.
Thank you so much.
Thank
Kaylan
you.
Haywood II. Let's get out there and give out some turkeys.
I'm ready.
All right. And as we've talked about, we saw a record number of people come out for the midterm elections and let their voices be heard. And they re-elected to the 4th Congressional District of Wisconsin, the one and only Gwen Moore. How are you?
Hey, I am absolutely delighted and so happy that people decided to enfranchise themselves. I think people were engaged, and you know, elections have consequences, and I think we have some good things ahead of us. Really happy to be here with you at the Milwaukee Health Services, and it's a great collaboration of community leaders that has made this, it's not just a Thanksgiving giveaway, but I understand there are going to be health checks.
Absolutely.
Wellness checks that could save people's lives.
Yes, and we know that you spend a lot of time in the nation's capital doing the work, but how does it feel for you to be able to come home and see the constituents and be here for the holiday season?
This is absolutely the thing that renews me. I've lived literally in the same apartment building since I went to Washington, D.C., but that is not my home. My home is right here in Milwaukee. And when you say that you understand what your constituents' needs are, that has to manifest itself in your experiences with them. So I'm really glad to be here with my constituents, watching them consume health care products that, and there's a dearth of them, and we are at such risk at this time of not having basic healthcare needs being provided. And this is a reminder when I see hundreds of people lined up for these screenings today and services. It's a reminder of the essential need of basic human rights such as health care.
Absolutely. And so when we look back at the elections, of course, we had some huge changes for our state. We have Tony Evers, who's taken over as Wisconsin governor, Mandela Barnes as the first African American to be elected as lieutenant governor for Wisconsin. And we know that the change of leadership is going to mean a change in many different things. Over time, you have written as a legislator your concerns for the Medicaid work requirement waiver, and then also there were many seniors and individuals with disabilities who were having their food share benefits cut. So in your opinion, what does all that mean now that we're going under new leadership?
Well, I'm really delighted that Tony Evers, Mandela Barnes have taken over the gubernatorial and lieutenant gubernatorial helms. Because I do think one of the thing that people who are poor, displaced from the workforce because of reasons that are not necessarily any fault of theirs or lack of personal good characteristics, there's a mismatch in their skills and work that's available. They've been laid off, they're middle-aged, they're not yet 64, but they don't qualify for disability. There are lots of reasons that people are out of work and are poor, and they didn't need to be maltreated or mistreated and assumed to be criminals, which is why some of the urine testing sort of ran afoul of people's basic constitutional rights. But the waiver that we have now to require people to work is sort of redundant. Most of the people who receive food stamps, SNAP for example, 80% of those people work in the year before or the year after they've received this benefit. People want to be independent, but the low flat wages, the seasonal work, all kinds of things can mean that a person is in need of these services. And actually, these waivers were sought really just to discourage people from seeking the benefit. Sort of mean-spirited if you stop and think about it, Andrea. So I do think that someone like Tony Evers it will, and we see the Republicans are trying to diminish his powers as a governor because
before he even gets in there.
That's right.
Yeah.
So his capacity to withdraw the waiver to require people to work. I mean, if people were working, they perhaps would have a job that had health care benefits as part of the working contract. They are the most vulnerable people, so he'll try to do that. But he'll also try to expand Medicaid, and that's going to be very, very difficult with a minority in the legislature. But thank God we picked up one legislative seat, 35 out of 99, and that sort of gives us the sort of an override protection from vetoes that the governor might be able to have sustained, you know, to prevent sort of the worst, most egregious policies from going through. And so it's going to be contentious, but a good day will be a day that our governor is able to stop a rampant, you know, out of control majority and unfair majority, given the gerrymandering in the state, from just destroying the great Wisconsin idea.
Wow, it's going to be all very interesting, but I appreciate you coming by. And one last thing before we let you go, because I know you're really here to get up there and really see the people, touch the people, and be a part of putting a smile on the faces of the individuals who have come here today. So you most recently introduced HR 7142, and that's the National De-Escalation of Violence and Community Safety Training Act. If you could help us better understand what that is and what you're hoping to accomplish.
Oh, I am so proud of this legislation. I have really had tremendous support from groups, most notably Dr. Stephanie Meyer's Black Women for a Positive Change, who've really pushed for this de-escalation training. This de-escalation training would say that police officers and police agencies would have to provide training to their police officers in de-escalating situation before they just shoot. That they would have to assess a situation and use sort of the least restrictive sort of responses if possible. What we have found from a best practices book, the police executive research forum. It's a peer group of police officers that put together recommendations for professional police forces. And one of their recommendations was de-escalation training. Right now, officers are giving 50-some hours in defensive tactics and 50-some other hours in shooting, and only 8, mostly volunteer hours of training in de-escalating a situation. The Dallas Police Force adopted this recommendation. They found that they had less crime, less violent, fatal police community interactions, more community police collaboration, and that it actually does work.
All right.
And so we're very hopeful about getting this across the finish line. It's common sense legislation.
Yeah, and when I read it, you're absolutely right. We're in a time when we see political, racial, and social economic divides at an all-time high and going to extremes on so many different levels. And then just one last thing, I can't help but talk about the record number of women that we saw get elected and go to Washington, D.C., and they're going to be right there with you working, and you guys have the majority of the House. So talk about that.
This is really exciting to serve at a time when we have a record number of women, mostly Democrats. It was really sad to see there are only 13 new Republican women, 13 women. And it was sad to see how hard it was to negotiate common sense stuff like maintaining birth control, because you really didn't have people at the table who understood gender and wanted to maintain Congress and all of its appropriations and considerations in a, hyper, uber masculine frame.
Yeah.
I think we have women who have backgrounds in the CIA, military backgrounds. They're going to sit at these seats on the Armed Services Committee. And I really think that we're going to have some voices that are going to enable us to really ratchet down some of the wars that we've been in. Certainly, it feels very exciting to have a body politic that is comprised of people who actually look like Americans. When I ran for Congress, there had been less than 200 women in the entire history of our country who had ever been elected to Congress. And so it is really excited now to hear our voices and to see ourselves at the table.
Yes.
But you know what they say, if you're not at the table, you're on the menu.
Especially in the world of politics. That's right. And so it's really, I think that when we look at the Senate and then the House, things are going to be getting very interesting, to say the least.
Well, yeah, and we do have some sort of firebrands, that are coming into our body. We have the youngest woman who's ever been elected, and I've seen her in the media. She is young and energetic, but she seems to have some common sense. And so we'll see, but we'll be supporting each other. And you see a little disarray now, but we realize that we have to govern. And so we're going to try to clean up some of the stuff that's gone on wrong in the last couple of years. But we need to stabilize the healthcare system. This is, I think, one of the most important missions that we have, to try to provide healthcare at some sort of level of affordability. That's going to be a tremendous challenge. I see that the president, some of the senators are putting justice reform on the table, immigration reform. So it is going to be a very busy 2 years.
Oh, absolutely. Thank you so much for your time, and all the best to you. It is our Congresswoman, the one and only Gwen Moore.
Thank you, Andrea.
A special thank you to Dr. Tito Izzard and her friends at Milwaukee Health Services Incorporated's MLK Heritage Health Center on King Drive. Keep in mind, on Thursday, December 20th, MHSI will be giving out free Christmas dinners at the Isaac Cogg's Heritage Health Center from 1 to 4 p.m. at 8200 West Silver Spring Drive. For more information, contact Pamela Clark at 414-267-2655.